Capstone, 5-Year Plan Presentation by Michael Loughlin. Hello, my name is Michael Loughlin. I've been a registered nurse for 15 years now. My educational history includes my LVN and RN from Lamar State College, Port Arthur, and anticipated graduation from the baccalaureate program at Lamar University in December of 2018. My work history is as follows. From 2003 to 2012, I worked in the cardiovascular intensive care unit. Training included cardiac and non-cardiac thoracic surgeries. These include, but not limited to, aortic coronary bypass, often known as CABG, thoracoabdominal aortic aneurysm, or TAAAs. Experience includes also managing severely acutely ill patients such as cardiogenic shock with multiple vasoactive agents, severe left and right ventricular failure, ARDS. I have extensive training on cardiopulmonary assist devices such as vents, paracorporeal, left ventricular assist devices, PLVADs, and extracorporeal membrane oxygenation, or ECMO. From 2012 to the present, I've been employed in CCU. My training here includes managing patients in this environment such as cardiogenic shock, myocardial infarction, and again cardiogenic shock. I've also received extensive training to manage and circulate during STEMI cases in the cath lab. My certification includes CCRN. The remainder of this presentation will show the 5 student learning outcomes that are to be met in this course, and I shall demonstrate evidence as to how they were completed. First, we'll start with the Humanity and Society construct. This objective is to practice safe and effective holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. Excuse me. The assignments I believe felt completed were from Nursing 4550, Nursing Practice and Leadership and Management, the Global Health PowerPoint, and also Nursing 4316, Comprehensive Health Assessment, the comprehensive assessment itself. I believe these objectives were met 95%. The next construct is the Lifespan Health Continuum. The learning objectives here is to support patient clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity, and also to evaluate patient-centered care for patients across the lifespan based on common and complex health needs, and compromise multiple health states when considering multiple determinants of health. I believe the assignments that addressed these were from Nursing 4620, Care of the Patient with Compromised Multiple Health States, the CBSL PowerPoint activity, and also Nursing 4540, Care of Communities, the Project Teaching Plan 4. I believe these objectives were met by 95%. The next construct is evidence-based practice and clinical reasoning. The learning objective here was to synthesize clinical judgment in nursing practice utilizing critical thinking nursing process, research, and evidence-based practice. I believe the assignments that met this objective were Nursing 4550, Leadership and Management, the Practicum Assignment, the Clinical Application, and Nursing 4390, Nursing Inquiry and Evidence-Based Practice, Quantitative Research Article Critique. I believe this objective was met 100%. Next is a patient-client-centered care construct. The learning objective is to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. I believe the assignment that met this objective was Nursing 4620, Compromise in Multiple Health States, Practicum Reflections 1 and 2. I believe this objective was met 95%. And lastly, for the professional roles construct, the learning objectives here is to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for a patient client as a member of the interprofessional and intraprofessional healthcare team, and also demonstrates professional integrity, effective communication, active inquiry, and service to the community. I believe the assignments that met these objectives were from Nursing 4540, Care of Communities, the CBSL Civic Pride and Diversity Initiatives Project, and also for Nursing 4620, Compromise in Multiple Health States, the CBSL Activity PowerPoint. I believe these objectives were met 100%. For my 5-year plan, although I have a general idea, I'm not entirely certain what it is, but it will go as follows. I plan to recertify with the ACN, maintain my CCRN certification. I also plan to attain the CMC and CSC certifications through the ACN in conjunction with my CCRN. I also plan to take the GRE and any undergraduate prerequisites that would require me to go required for graduate school by the spring of 2019. I also plan to enroll in the BS in the DNP program, either CRNA or acute care nurse practitioner, by the summer of 2019. I haven't completely decided on which yet. I suppose I will choose which is the best fit for me. And I believe that with tremendous focus and dedication, whatever I choose, I hope to achieve my full potential. And that is the conclusion of this presentation. Thank you for your time.